Good afternoon and welcome to the National Hispanic Council on Aging's Lessons from the Field, Perspectives from Latinx Participants in Health Research. My name is Christina Pacheco and I am NHCOA's Director of Resource Development and Policy, and it's my pleasure to be moderating today's webinar. Due to the ongoing COVID-19 pandemic, the National Hispanic Council on Aging is developing innovative ways to continue engaging, informing, and listening to communities. For 52 years, NHCOA has worked to improve the lives of Hispanic older adults, their families, and caregivers. This year, we continue that commitment. This afternoon, we will hear from amazingly diverse Latinx panelists who have agreed to share their experiences and perspectives on participating in health research and how they believe researchers can engage other Latinx Americans in engaging in health research, such as the All of Us research program. To start off, I want to provide a brief overview of the All of Us research project, which has made this webinar possible. All of Us is a research program created by the National Institutes of Health that aims to enroll volunteers of diverse backgrounds into the study in order to better understand how disease develops and how we might be able to treat it in the future. You can forward to this All of Us program slides. That would be fantastic. Okay, and NHCOA's role in the All of Us research program is to facilitate the education and engagement of Hispanic older adults, their families, and caregivers in this program. Although the term precision medicine is relatively new, the concept has been a part of healthcare for many years. For example, a person who needs a blood transfusion is not given blood from a randomly selected donor. Instead, the donor's blood type is matched to the recipient to reduce the risk of complications. Examples of precision medicine can be found in several areas. Think of, for instance, prescription glasses, hearing aids, and insulin pumps. However, the role of precision medicine in day-to-day healthcare is limited, and researchers hope that this approach will expand to many areas of health and healthcare in the coming years. Next slide. The All of Us research program is an effort to bring together 1 million or more participants who reflect the diversity of people living in the United States who will volunteer their health data over a decade or more. The program is open to people both healthy and sick from all communities. Unlike a single research study focused on specific diseases or population, All of Us will serve as a national research resource to inform thousands of studies covering a wide variety of health conditions. Led by the National Institutes of Health, its cornerstone of precision medicine initiative that was launched in 2015 with the goal of moving forward the promises of precision medicine. A set of core values are central to the All of Us research program and guide its commitment to doing things differently. These values are: participation is open to all, participants reflect the rich diversity of the United States, participants are seen as partners in the research, trust is earned through transparency, participants have access to their information, data will be accessed broadly for research purposes, security and privacy are of the highest importance, and the program will be a catalyst for positive change in research. Next. The All of Us research program mission is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. There are 3 primary objectives to achieve this bold mission. 1, to build and nurture trusted relationships with participants. 2, to deliver a valuable, rich resource of data, which will be accessible in new ways. And 3, to catalyze a robust ecosystem of researchers who want to use the data. Next. This diagram shows how participants move through the program and how this program works. Participants share their health data online, and this data can include surveys and access to health records and biological samples as well. The data is protected, personal identifiers are removed, and blood and urine are stored in secure biobanks. In the future, approved researchers can use the data to conduct studies. Participants get that information back, and then researchers share their discoveries. Next. The value of participating in All of Us resonates differently with individuals and communities. It can be an opportunity to learn some of your own health indicators and get your own data. an opportunity to fight disease and improve the health of future generations, an opportunity to ensure that your community is included in studies that may lead to new understandings and new treatments, or an opportunity to be a part of a movement to make our healthcare more precise and more personal, thus more effective. Next. The All of Us research program's most important responsibility is to safeguard our participants' identity and data, and the program is using the highest standards of privacy and data security to protect participant data and information. The program knows that participants want to understand what data will be collected and how it will be returned to them, and they absolutely want assurances that this data is protected to the highest standards. Precautionary steps that are being taken are end-to-end encryption, penetration tests, and anything that they can figure out or use to figure out if there's any vulnerabilities in the systems. Next. To learn more or to seek answers to any additional questions you might have about the program, we urge you to visit the program's website at joinallofus.org. You can also follow the program on social media at #joinallofus. While Latinos represent more than 18% of the population in the United States, fewer than 1% of Latinos participate in National Institutes of Health funded research, and overall Latinos make up roughly 5% of clinical trial participants. Being left out of health research can have significant negative impacts for our communities, as there are real differences in how people of diverse backgrounds respond to different diseases. For instance, when new programs, drugs, or therapies are developed for diseases that affect our community, it's helpful to know how people like us, or to know that people like us were in the study. Enhancing diversity in research doesn't always mean we'll find differences by race, ethnicity, or other traits, but when we do, those differences have been important. For instance, we know that diabetes is twice as likely among Latinos compared to non-Latino whites. That tells us that something different is happening. It could be the way that the body responds to the food that is being eaten, environmentally related to access, but we would not be able to determine that without Latinos participating in research. Today, we'll hear from a diverse Latino American panel on their experiences with research and how they believe we can increase participation of our communities. We start with a video of Maria Hernandez, who is unable to join us today. Ms. Hernandez is an older adult who resides at Casa Iris, one of NHCOA's older adult housing facilities. She participated in a clinical trial at Howard University College of Medicine aimed at addressing urinary incontinence among older Hispanic women. Let's hear her story.
Hola, mi nombre es María B. Hernández y soy salvadoreña y tengo 70 años. Bueno, yo decidí a participar en este programa de la continencia urinaria porque la señorita Christina me hizo que ellos tenían un programa y entonces yo pues decidí, pensé mucho, pero decidí a ir porque yo dije, esto es para mi bien, pero sí tenía miedo, porque le hacen a uno, le hacen tantas cosas, pero gracias a Dios pues que fui y yo se lo recomiendo a muchas personas que están tal vez padeciendo de esa misma enfermedad de la continencia urinaria, porque a mí me ha resultado muy bien. No hay necesidad de operación, no hay necesidad de otras cosas, nada más que hacer el ejercicio que le dicen ellos a uno y eso da efecto. Así que yo se lo recomiendo a las personas que están con ese problema. Preocupaciones fueron que no sabía qué me iban a decir y qué es lo que tenía que hacer. Pero ya cuando ya empecé a ir a las, digamos como a terapias, ¿no? Entonces ya se me hizo, sentía miedo, pero después yo la sentí más fácil, porque era solo de los ejercicios. Y cuando me llevaron también que lo hicieron otros exámenes, MRI, yo sentía pánico, pero decía yo, lo voy a hacer. Y voy a tratar de relajarme y esto me lo hago porque es para mi bien. Y así pues todas las cosas que ocurrieron haciendo los exámenes y lo que nos hicieron en la clínica fueron muy perfectas. Y así pues que yo los invito que también todos pudiéramos hacer lo mismo de aceptar lo que nos dicen para el bien de nuestro cuerpo, es lo mejor. Yo lo que les diría es a estas personas que tienen ese problema de la continencia urinaria, que no teman a hacer los exámenes, que cuando les inviten a hacer estos es para el bien de nuestro cuerpo, de cada uno de ustedes. Así que yo creo que lo mejor es hacerlo que uno le diga y es para el bien de cada quien. Porque nosotros las personas adultas a veces somos muy temerosas o miedos, pero no hay que tener miedo porque es para nuestro bien, de nuestras vidas, de nosotros, para seguir mejor en calidad de vida. Porque eso estar con ese programa, con ese efecto de que uno anda con pampers y anda a veces se hace pipí, eso es horrible. Y es mejor atender a los ¿cómo se dice? A los exámenes y los ejercicios que se hacen, que es lo mejor para cada uno de nosotros. Así que yo los invito a que lo hagan, que acepten cuando les dicen que van a hacer algún programa de estas, como la que yo recibí, que no se nieguen, háganlo, porque es lo mejor para ustedes mismos.
Ms. Hernandez raised some excellent points about some of the reasons why Latinos may not participate in research, one of them being fear of the unknown, and we will expand on this a little later in our webinar. Now let's meet our panel, who will begin by sharing information about themselves and their personal experiences with research. A link to view the full bios of our panelists is shared in the chat box. After introductions, we'll move to a facilitated discussion with our panelists. If you have any questions, please type them in the chat box and we will address as many of them as possible during our question and answer session. All right, welcome. Edwin, can you start off by introducing yourself and telling us a little bit about the communities in which you are a part of?
Sure, no problem. Buenas tardes, good afternoon. My name is Edwin Maldonado, and I am presently the Community Engagement Program Manager for the All of Us Research Program at the Medical College of Wisconsin. I work throughout the whole city, but I've been concentrating a lot more in the Latino community simply because I grew up and I live in that area still. I've been here most of my life in the city, and I see the need to have to be there, to be involved, and to help out the community. So that's a little bit about me for now.
Thank you. Angie?
Hi, thanks, Christina. Hi, everyone. I'm Angie Gonzalez, and I am half Puerto Rican, half Cuban. I am currently an outreach and engagement manager for the All of Us Research Program. And our main focus is outreach and education for underrepresented communities all across the US, because there are so many groups out there, whether it's racial and ethnic minorities or, you know, people living with disabilities or LGBTQ, lots of people who haven't had a chance to take part in research before.
Thank you. Welcome. Yuri?
Buenas tardes a todos. Mi nombre es Yuri Velázquez. My name is Yuri Velázquez. I live currently in Tulsa, Oklahoma. My home is actually in Washington, D.C., but I'm doing a little side project here. I belong to the LGBTQ group. I am also Latino. I was born in Nicaragua and moved to New York City when I was about 8 years old. So I've been in the United States for a very long time now. And I am also HIV positive. So that is one of the reasons why I love to participate in research, because with our participation, with my participation, I believe that we can end the HIV epidemic. And I will talk a little bit more about that.
Thank you. Michelle?
Good afternoon, everyone. Buenas tardes. Michelle LaRue. I'm a physician by training, but I've been specializing in public health, especially in the Latino community for the last, well, 15 years or so. I'm originally from Guatemala and have been working in the Mid-Atlantic region based out of DC, so working in Pennsylvania, Maryland, and Virginia. This is, I think, a critical time to be talking about this as we're in the middle of a pandemic and having vaccines coming out. CASA, which is the organization where I'm working currently, have been working on recruiting participants for various COVID vaccines and the importance of our participation in these to make sure that we also benefit from the protective factors of the vaccine.
Fantastic. Thank you and welcome to all of you. All of our panelists have participated in at least one health research study. Angie, can you briefly share with us pick one research study you participated in and tell us a little bit about what it was about? Oh.
Muted. Yes, of course. I actually am a participant in the All of Us research program. The All of Us research program is, as you mentioned, looking to create a very large database that is just as rich and diverse as the United States is, giving everyone that chance to have a voice in research. I think one of the reasons I decided to join the program was because, as you mentioned, Hispanics make more than 18% of the population, but we're not very well represented in clinical studies. I not only wanted to help future generations, I think about my niece and my nephew and their future health, but also, my community and generations to come. And like I said, just to have a voice in research. Another thing I really, that motivated me about joining a research program was All of Us makes it really easy to want to be a part of it with their goal, but also I felt like I had a level of control with this program. It's very forgiving and very much voluntary. You don't have to answer every question. You don't have to participate in every portion of it because at the end of the day, all information is valuable. So whatever we choose to share is going to help someone.
Thank you. Yuri, can you share with us about one of the health research studies you participated in?
Of course. Thank you. One of the, as I mentioned earlier in my introduction, I am HIV positive. And so throughout my diagnosis, I've been in many research that deal with HIV and medication. But I think one of the important things that I participated in is medication adherence. As you know, taking a pill, taking a couple of pills once a day, or different types of days, it can be challenging, right? Especially if you work, right? And particularly if the medication needs to be taken with food, right? You have to really time that with your breakfast, with your lunch, or with your dinner, however you take that. So one of the researches that I participated on is medication adherence, because it's very important to adhere to the medication, to stick to a regimen, to a schedule, because otherwise the medication is not going to work. So I think that researches such as these, and also the All of Us research program, which I'm also a participant on, will benefit the overall communities, because they not only will benefit your health, but also benefit, like Angie said, the health of your family and the community as a whole. So yeah, that's about it.
Great. Michelle, tell us about a study you participated in.
Yeah, I mean, I think it's critical twofold for participating in clinical trials. On a personal note, I think, what we gain from trying to be part of the pioneering of a new intervention, but also from a public health point of view, being able to then turn around and use this experience and use this information to help spread the word to the community that we can trust this new intervention, this new whether it's a new procedure or a new pharmaceutical or whatever the clinical trial is about, I think for me is really critical. Like I said, from the personal notes, feeling like I was part of it, but then I think it goes to not only educate the community, but also bridge the trust that we need to still build with our community and pass on that information as well.
Edwin, do you want to share with us about a research study you participated in?
Sure. Just like everybody else, I'm also part of the All of Us research program, a participant. To be honest with you, I was fearful at first, but then I started seeing the needs about it. Having been with the Latino community for over 40 years, talking and reaching out to them, I saw a need of me leading by example. Can't practice what you don't, you can't preach what you don't practice. So came on board, and to be honest with you, it has been very educational, very helpful for me, and to the point of that I feel easy when I speak to the community and sharing about the study, because I'm part of it and I can share my experience. And when you share your experience, that speaks volumes compared to just saying it, but you're actually living through it. So I really enjoyed it, learning about myself, and also at the same time learning about the future of my family, of how I can help them also.
Fantastic. Michelle, what concerns or considerations did you have before agreeing to participate in research?
For me personally, I think it was years of mistrust in government. Coming from Guatemala, somewhere where the Tuskegee trials were replicated after having been performed here in the U.S., I had some serious reservations. And so really being able to see a little bit more the behind the scenes, I think with the All of Us program, there's a lot of transparency. And we're really trying to replicate the diversity that is the U.S. population. I think these are really critical in tipping the scales for me to participate in the All of Us program.
What kind of questions, or if any, did you ask before agreeing to participate?
I really was wanting to know in depth what were the steps. I'm very much in the weeds of the logistics of the program, and so I think the transparency there, and I think as Angie was mentioning, being able to say yes or no step by step was a critical piece of being able to hold that control as well. But overall, I mean, I think this is a really important program. The transparency, as I mentioned, I think was critical for me in my deciding factors. But just learning overall and being able to also access the data and kind of see how the program is progressing, and being able to look at the summaries and not feel that everything was kind of hidden behind the walls was really critical for me.
Thank you. Edwin, any questions or concerns with participating in All of Us or any other research study that you participated in?
Yeah, one of the first questions I ask is how many other Latinos have been part of it, simply because of all the experiences I've seen and I've heard of. I didn't want to be another number. I wanted to be looked at as an individual. And then when they started explaining to me what precision medicine was, it caught my eye. I mean, my father passed away from a deformed vein in the head, and he had a stroke, and that was never detected in 74 years that he lived. And then my mother is one of 3 of her family members that passed away from Alzheimer's, and nobody could give me an answer of why, and nobody knew where to start. So my curiosity brought me here to kind of like say, well, let me see, maybe I could be that bridge or that gap that's missing, and get it going. And what I have found out has been amazing, and not only helped me, but it's helping my children and my grandchildren for their future. So now they know what to watch out for and the signs. My other concern was, can you relate to me as a Latino? Do you understand my culture? Do you understand my background? Do you understand my lifestyle? And in the same way, I've seen a lot of that happening in the community, that lack of knowledge. And I didn't want it to be looked at as, again, just another person. I wanted to be looked at as a Latino male. And how can this benefit me? And how can I walk away from here feeling better about my future and myself? So they were able to answer all those questions in a clear way with no doubt about it. So that's why I'm part of it, and I'm promoting it also as myself.
Fantastic, thank you. Angie, questions or concerns that you had prior to participating in research?
Yes. So I don't know if this is the Puerto Rican in me, but I was like, do I have to give my social security number? Do they have to know my name? What kind of personal information do I have to give? I don't want to give anything away to anyone, that kind of thing. So I was another reason, like Michelle was saying, really happy to find out that I don't have to do those things, that my identifiable information is stripped away from my samples and I'm assigned a code, and I can still help people and myself by, I did the whole thing. I did all of my samples, I did the measurements, I did the surveys, but you're free to choose and do whatever you want. So I think for me, the biggest thing was, what kind of personal information do you want from me and how are you protecting it? Because I'm just so skeptical, more along the lines like Michelle said, with government and the trust and the transparency. And so I had to do a little research on my own to make sure this was something I wanted to do. The last time I joined a research program, I was 18 years old and I couldn't tell you what it was because I did it just for the money. I was like, what is this? I don't care. How much? Okay, great. So it just goes to show, like, in life, motivations might be different at different times of life. So at this age, I had those concerns when I was younger. I didn't have any.
That's a great point. Thank you. And Yuri, do you want to share with us about your concerns or considerations that you had prior to participating in the research that you participated in?
Of course. So I do want to agree with everybody what they said about trust and what's in it for me and all that stuff. I think that it's only natural for the human being to think about all those questions, particularly because of all the historical miscommunication and mistrust that has happened, with government. Excuse me. So with me, I relate a little bit with what Edwin said earlier. With me, it was more about the participation and the the representation of the LGBT community in research. As you know, that gay and bisexual men, Latino men have been disproportionately affected by HIV and STDs and AIDS. So I wanted to do more, and I asked a lot of questions. Not only in the research that I participated in, but also when I came in on the All of Us research program. I said, "What are you?" So yes, you want to capture the diversity of the U.S., but which we usually think about racial diversity, right? But I said, what about the sexual gender minority? You need to represent not only Black and white and Asian and indigenous people and American Indians, but you also need to think about the LGBTQ community, because the lifestyle that we have may also affect research studies. It's not only about race; it's also about your lifestyle. It's also about the places where you live, right? And also family medical history. So when they told me that they were considering all of these factors, I said, yep, sign me in.
That's fantastic. Thank you. And again, great points. The Latino population is not homogeneous. We are very, very diverse, as you can tell by our panel. And that also needs to be taken into consideration by researchers when they're trying to encourage folks to participate. And so then last question for our round robin session. Edwin, if you could start with sharing with us about some positive experiences or benefits that you've seen having participated in research.
Sure, thank you. I think, wow, there's so many positive things to pick one. Working with the Latino community, I've seen how people are starting to take health more seriously now. At first, it was kind of like, I'll go to La Curandera and take care of things, or my little guarapo or té or tea or whatever I have to do. But now people are starting to look at their bodies in a different way. They're taking it more serious. They're looking at future, not so much today, but how about tomorrow? And also as a Latino culture, as we start to mix in our marriages with other cultures, we're starting to see a difference in our children, and we now the curiosity kicks in. How is this going to help them? How is it going to hurt them? So I'm just starting to see more Latinos getting involved in not only research, but just taking care of themselves and getting healthier, exercise, what I eat, what I don't eat, what I see, mental health as well as physical health. So we're starting to see that they're starting to open up about their background, their experiences, where before everything was stayed at home, whatever happens and at home stays in the house. No, don't tell the neighbors. But now people are opening up and talking about how they're feeling, what they're thinking, what their bodies are going through, and which is creating a bigger need in the Latino community that we see, which means we need more professional Latinos in the medical and health industry, because that's one thing that we lack that we need to grow in also.
Thank you. Angie?
I would say some of the, I would agree with Edwin, honestly, especially working with the All of Us research program. I think that more of the Hispanic community has become like aware or awake to this type of thing. Like, I think that more of us are not just acknowledging it and recognize it, but actually participating. And that's what I mean about the All of Us research program, where you're, seeing those numbers rise in underrepresented communities, even the Hispanic community. And I think that we're just now realizing the importance of being a part of things like this, and that, it's not just, that it may not help us in this very minute, but it's going to help us overall as a person of color, as a community. And I think that that's one of the positive things. I think that people are kind of, just learning more and wanting to know more about it. And I think showing that the numbers have increased is a positive thing.
Thank you. Yuri?
Yeah, again, I do want to echo what everybody said, but just sort of highlight the inclusivity of the program. I think that one of the highlights of the All of Us research program is that it's beyond inclusive, right? Like, some people just want to include certain underrepresented populations, but this is inclusive of all of the populations, right? And so I think that the fact that the Latino population is sort of listening, right, more, especially now with COVID and with other things that are going on. The positive thing about participating in research is that there is more opportunities to learn more about your health, to learn more about how your health can impact future generations, and also how your lifestyle or your your nutrition, where you live, and what you've been through can also affect or benefit future research that is going to come out of All of Us research. So it's just building up the data repository, right, with as much diversity as possible. I think that's the big highlight that I like to always talk to people about.
Thank you, everyone. So next, we're going to move into a discussion on Latino participation in research from a participant's perspective. I want to remind all of our attendees that if you have any questions for our panelists, please type them into the chat box and we'll address them in our next session. Yuri, kind of building off of what you just shared, can you speak a little bit to kind of, you've talked about your personal motivation, but maybe what motivates Latinos or LGBTQ individuals to participate in general in research?
Sure. So like I said, being a Latino man, a Latino gay man, Latino man who grew up, in under means or poverty in New York, I think that just being heard and being seen, is one of the things that is most important for us. One of the things that I saw a lot when I used to work in Miami for the health department was the fear of Latinos when it comes to going to the hospital or going to a clinic or anything related to the government. as you know, there is a significant percentage of people who live here undocumented. So the fact that what Angie was saying, that you don't need your social security number to participate, right, is something huge, because now they can see that the government, who is sometimes after them, it wants their participation, wants their biosamples. They want to talk to them about their medications. They want to talk about their health. They want to talk about their medical history. So we see a big flip, if you will, of interest, because now people are taking care of themselves, like Edwin was saying, and not only that, but people are being seen, and people are taken seriously, and they're seeing that the government, who sometimes was sort of like reluctant or hesitant to reach out to them, is saying, yeah, come in, we want to hear from you. We want you to participate, because your health is very important to us, and your health is very important to the community as a whole, and also to the future of research. So in my experience, especially again in the HIV AIDS world, is also very important, because we need to talk about it. HIV has been affecting us, not the Latino community, but the world since the mid '80s. So we want to really participate, no matter what's going on in your life. And the other thing, before you move on, is that the All of Us research program doesn't really care about what ailments you have or what conditions you have. As a matter of fact, if you have some type of condition, they really want to hear from you, because again, based on that, they will work with people who are suffering from the same condition and build research around that. So I think that's my 2 cents.
I agree with Yuri. I think that going back to what he was saying, it almost touches on like the transparency of the program, right? Like they've made it so easy for us to have a voice and to be a part of it by eliminating that fear that we had. I mean, I never went to the doctor. I don't know if that was also a family thing of mine. We just didn't go. And I feel like I always just felt like they were just going to treat me like everyone else. They were just going to follow a protocol in a book, whatever they learned when they were in school. And I always felt like, but they don't know everything. They don't, all of us, are different from one another, our lifestyles, our environment, our genetics. And when we go to the doctor, we're all treated the same way. So I think there's definitely different motivational factors among the Latinx community that will bring us in. But I think all of us did a really good job of trying to eliminate that fear and be transparent and say, hey, you don't have to do all of this, be documented. You just have to have a residence in the United States, and you too can be heard.
Yeah, I have to agree. Talking on behalf of the older generation, Latinos, a lot of our older generations never went to the doctor. We just learned what our grandparents told us and their parents, and said it worked for them. Why wouldn't it work for us? But then we don't think that we're not in our native countries anymore. We're in a whole different country with different environment around us, different things affecting us, different foods, and they're starting to see that, hey, I can make a difference for my children, my grandchildren, and my great-grandchildren. And once they hear about the program and see the importance of health research, they're more open to hearing more. And I think that's been a big plus in the community where I work with.
Yeah, I agree with Edwin. I think this is a culture shift that we're still in the process of changing from just going to the doctor when we're sick to really valuing preventive medicine. And I think that's where this All of Us program really fits in well. And also with clinical trials too. I mean, I think we've traditionally looked at clinical trials as something you do when there's other avenues of treatment have been exhausted, kind of looking at a last minute or last chance treatments. And so really looking at participation in research in a whole different light, and looking at what we gain and not just, what we gain as a community and not just the immediate research goals on a personal note, but looking at it more culturally, I think also, many times we've just heard, what other generations have passed away from, but really not understood truly our family history, really not really taken into consideration a lot of our genetics and our environment as well. And since we are so diverse, even within the Latino culture, I think this is also critical for us participating in programs like this.
And Angie, earlier you mentioned that motivations change, and they did for you when you were considering participation. How is that, something that should be taken into consideration by researchers when they're trying to target different groups, whether it's age or sex, national origin?
I think that is something that might be a little difficult because, like I said, when I was younger, I think it all depends on your individual circumstances. Like you might be a box on a paper in this, this checkbox, but all of your life circumstances might be different from someone else. So I might be between the ages of 24 and 35, but there's other factors that affect my health. So trying to motivate me just based on age might be kind of difficult. I think we have to think about what else is going on in that, like those demographics and their lives that aren't just, like a checkbox. Like a good example is when I was younger, like I said, I did it for the monetary value, but as an adult, MS runs in my family. And I feel like the cycle will only continue unless we can get some research done and get some answers. And the only way to do that is to get more people, in my community to be a part of it. So as I grew up, I kind of had a different motivation. We found things out and we know that this is in my family. And I feel like it's just very, very important for, researchers and the medical community to really understand the nuances within these, populations of color or these underrepresented populations so that we're not left with medications and things that were created for other groups. And I really do feel like, if we and other communities of color, don't participate, we might find ourselves at a disadvantage. So I just grew up with different motivational factors. I started realizing, like Edwin said, that I was taking my health into my own hands when, before it wasn't at the forefront of my mind. As I grew up, I became healthier, as I got older, and so many different factors in my life contributed to that. So I feel like it'd be a big task.
I agree with Angie. I know that one of the things I think that's helping out is that we're starting to look at our ancestors and what did they die of? What was their illnesses? Because I know in my mom's case with Alzheimer's, until she passed, I didn't know that she was a third one of her family that had passed away from the same illness. So it made me want to go back and research and find out what other illnesses. Of course, the typical high blood pressure, diabetes, which is normal for the Latino community, and heart disease. But Alzheimer's was something new for me watching it. At first I didn't know what it was. I would look at it like, oh, they're going crazy, or they're getting old, they're getting senile, because that's the only thing I knew. But after experiencing it with my mother and one of my uncles, it made me look at it from a whole different angle. And at the same time, it opened up the eyes to the rest of my family. Even my cousins and my uncles and aunts, they started going, wow, this is something serious. Maybe that is what so-and-so had, and I thought it was something else. So they're becoming more educated in the sense of family health history, which helps them too, because then when they go to the doctor, one of the things the doctor asks, is there any family history in this field? And normally I would say no, because why? I was ashamed to admit that some of my family members have certain illnesses because I was afraid I would get tagged or labeled. So I would leave it blank or say no. But now I see that by doing this and answering it correctly, it's going to help me a lot better. So when they diagnose me, they know where to start. It's not like a start on square one, but no, hey, well, now we have an idea where you come from. And that's one of the things that Latinos are starting to learn is we have to be honest about our health history and our family health history, because that's the only way we're going to find out what's really causing some of these illnesses.
Agree. If I may, sorry, I lost my connection really quickly. So, I grew up in New York, and then I worked at the hospital in Miami for about 10 years. And I think that, growing up in that environment of health, right? Being exposed to hospitals all the time, or being exposed to your family, your older folks being sick of whatever, and I think that the education, I come from a background of education. I'm a social worker by trade, and I love teaching or educating younger folks, or just anybody for that matter, about the importance of health. And I'll give you an example very quickly. My mom, she is 59, and she rarely goes to the doctor. And and I always tell her, drink water, do this, because she loves to take just over-the-counter stuff or herbal remedies when she's sick. I think that's a very Hispanic Latino thing. You just do your tea, or when you have a sore throat, you do your lime, lemon with honey. So I say this is not just herbal remedy or things that can work, right? If it's nothing too severe, but when it comes to something more severe than that, you need to go to a doctor, you need to go to the hospital, you need to be diagnosed with something. So I've been slowly teaching her that, you need to go to the doctor regularly, not just whenever you're sick. You need to go at least once a year, and more often, obviously, if you're of a certain age, right? So to me, I think that the younger that you start to teach about the importance of health and self-awareness, I think it's going to help us and the next generation to take health seriously. And again, this research program is teaching us that, because it's teaching us that you can share as much information as possible, but if you share, everything that is being asked of you, you have a higher chance to learn more about, your medical history, to sort of predict what's going to happen to you in the future, to your kids, within your family. So I really appreciate the fact that this program is inclusive, right? Not only of all the diversity populations, but it's also inclusive of all the other conditions that someone may have, or you may have a history of. So that's what I wanted to share.
I'd like to kind of flip it just a little bit. I think for me too, especially as in the context of the pandemic that we're living in now, the participation that we are bringing to the table in the research or in clinical trials has really been such a huge tool to then turn around and talk to the community again. Especially when it comes to like the vaccines. We've been helping with the recruitment of participants in the vaccine trials, and being able to then help talk about, with those that may have hesitancy with the vaccines, and the importance of having been participating in these trials, and having our same community members that did participate as ambassadors of this, and something that is so critically important as putting a stop to this pandemic. We know that not only the vaccines or interventions in general, but even the infection reacts differently to different people. And so to be able to truly say, we had a hand in this, we participated in this, we know it works in us, it worked in me, has been such an amazing tool. And I think that it goes obviously way beyond the pandemic and these vaccine trials.
Thank you, Michelle. That's actually a great segue into our next question, which kind of builds on this motivation issue. And Angie, you shared with us that your family has a history of MS. So let's talk a little bit about why it's important for people, Latinos in particular, Latinos of different backgrounds, to really participate in health research, and what kind of messaging, we're kind of cheating because of the number of engagement counselors we have on here, but what kind of messaging has resonated in the communities that you represent and serve?
To answer the first part, I would say if we don't participate, researchers will just continue to know very little about us, and then we won't get to help change the future of health for our communities. As far as messaging, I think what works best, and not just the All of Us research program, but maybe any program where you really want to engage people, is the face-to-face interaction. Being part of the All of Us research program, before this, I was a tour manager that actually toured the entire country and had one-on-one conversations in these communities with my community just all over the US. And I think that really makes a difference when you can have a connection, when you can share your information, and it doesn't seem like someone's trying to get something from you. It's really just being part of a community and sharing this information, and then they're free to do with that what they want. But they're left with a quality conversation and the information that they need to make a choice. It's like arming them with the information that they need to make the choice if they choose to. But I think face-to-face interaction like kind of trumps all kind of messaging, because I think it's the connection that you make with people.
Great. Others?
I think for me, having worked with the Latino community for 40 years in different aspects, when someone who looks like them and sounds like them approaches them, what you say just takes a whole different value. And that's one of the weaknesses in the health industry is we don't have enough Latinos who are there who represent our communities. One thing is for someone, a doctor, to come and tell me something and they don't know about my background or how I grew up or whatever. Another one is one that comes up and sounds like you and even has the accent or comes up and says, "Wepa," and stuff like that, and you're going like, wow, we can relate. So all of a sudden your guard goes down. Now I'm willing to listen. And once you hear that, and then once you share with them, they listen and then they ask questions. They go on because now they feel like we're communicating with each other. It doesn't matter if it's what Latino it is or biracial, whatever. But when you find someone that you feel like we have a connection, automatically it just opens up doors. And then when you share your experiences with them, that even opens up more doors because now they feel like you understand me. I can relate to you and you can relate to me. Now we can have a conversation. And one of the things I've noticed in the community is that, and again, I've gone throughout Milwaukee and different parts of Wisconsin to reach out to different groups. But it's amazing how the Latinos automatically gravitate to me because they see someone like them and they feel like, okay, I'm going to get an honest answer. So that helps a ton when it comes to that, even to any kind of research for that matter, because they feel, hey, they understand me. I can relate to what's going to happen here, and I've seen it happen many times. I've been at engagements. I've been at community events, and there might be 3 of us, all different ethnic groups, but every Latino always comes towards me. And then when they hear that I can speak Spanish, boy, what a sigh of relief right off the bat, because I can speak in my language and now I can share with them the different things and they know what I'm talking about. I don't have to explain everything. And that's one of the things that happened with my mother. My mother, when she started feeling ill, she would be afraid to go to the doctor because she'd always have to ask one of us to go with her to be able to translate and interpret things. And she felt uncomfortable because she didn't want to bother us. Like she would say, "Oh, I know you're busy doing things. I don't want to bother you. But if you can come with me next week, I got a doctor appointment." And there'd be many times where even my father, he canceled an appointment with a neurologist the week before he passed, because he couldn't find someone that could speak Spanish to take him over so he could explain his condition. Whether that would have made a difference or not, I don't know. But it wouldn't have hurt, you know. So a lot of times I tell people, don't be afraid to ask, even if it sounds choppy, just share it or ask for an interpreter or a translator, whatever you need. There's someone available to help you out so you can get your message across. And that's one of the things that I'm seeing in the Latino community. They're starting to open up. One of our most popular clinics here is 16th Street Community Health Center, which most of the staff is bilingual. And I'd say about 60% of the Latinos on the South Side go to that clinic. Why? Because they can relate to each other. I mean, you know how it is as a family. You don't come alone to an appointment. You bring the whole family. It's a vacation. It's an event, right? It's a trip. And you'll see them come in 6 or 7 people for one appointment for one person, but it's a family event. And then they're all asking questions. ¿Qué pasó? What's going on? What they say, this and that. And being able to meet that need and share that with them makes them feel like they want to come back. The confidence level just increases.
Definitely, I do wanna relate to that and agree totally, because being Latino and being bilingual, you always, people always gravitate towards you, and it's a site of relief, and it's a site of encouragement, just because they feel that because they look like you or you look like them, they can trust you enough to tell you the whole life story, which is good. When you have a 50-minute window to see the doctor, it's like, okay, fine. But yeah, I think one of the advantages that we have in this panel is that we're bilingual. But an advice that I would give to researchers and to organizations that they want to broaden their reach is, again, hire diversity. You need to hire diversity into your organization, into your researchers, because if you don't show the community that you are willing to learn from them, right? They're going to close their doors, or they're going to build a wall around you, and they're not even going to talk to you or even look at their way of the clinic. No matter how much they need these services, they're going to say, well, they don't speak Spanish, or they don't speak this, or they don't look like me, so I'm not going to go. So I have a quick funny story that happened when I used to work at the health department in Miami. Miami has a big Haitian community that speak Haitian Creole, right? It sounds like, for those of you who don't know, it sounds like French, right? But so if you speak French, you can totally communicate with them. I don't speak French at all. I speak a little bit of Italian, but that's nowhere near it. So I did my best to communicate with the Haitian population, and obviously they didn't have a lot of people that would translate, so I would use my Google Translate phone. I would get my phone, Google Translate, and do it. And let me tell you that the patient was such an awe that I was going above and beyond to provide the services, even though I didn't speak the language. But I said, you know what, I'm going to do everything in my power to relay the message that I need to tell you, for you to understand, and for you to get better, or for you to change your behavior and things like that. So any little effort that people do is welcome. And for us Latinos, we are very appreciative of any type of help that you want to give us, because we need the help, we want the help. And if you are trying to help us somehow, we'll do it, we'll buy it.
Yeah, I totally agree with what Edwin and Yuri have been saying. The trust is such a critical piece, and it starts with the communication. But it's not only communication. I mean, I'm completely bilingual, but I still, if I'm looking for a new provider, I first look to see if there are Latinos. And it's like, because there's just more connection. There's more openness to have conversations, or they're going to understand me better. So I totally agree that we need to have diversity, not only in the participants, but also in the researchers, to be able to foster that trust and that openness. Very critical.
And that really kind of leads us into our next question. Yuri, starting with you, given your experience as an advocate for HIV, STI, and viral hepatitis education and prevention, you have a good understanding that many groups are underrepresented in health research. And we've talked about some of the reasons why Latinos and Latino subgroups may choose not to participate, but let's expand on that.
Sure, thank you. So I briefly talked about the immigration issues that some Latinos face. When I worked within the HIV, STD, hepatitis field, I saw that there was a lot of cases, or an increased number of cases in the Latino community, because they would not go get tested for HIV and STDs anywhere, because they were afraid of question that related to immigration status. If you would go to the health department, they thought, well, health department is government related. They're probably going to ask me about my immigration status, and I can't go, right? Because I'm undocumented. So one of the things that I do want to share is that about 27%, roughly 27% of new cases of HIV come from within the Latino community. And that is something huge because, we make up about 17, 18%. And so it's a huge disproportion of new cases in our community. So going back to research, a lot of people are, like we saw the case of Maria earlier in the testimonial, she was afraid of what they were going to ask. She was afraid of what they were going to do to her body, right? And I think historically we've seen the horrors that that could happen from trusting the government, from trusting your healthcare providers, and not knowing what the next step is, of not knowing what they're going to do with your samples or what they're going to do with your DNA. We have the experience of Henrietta Lacks. They were just testing her for everything and basically stealing her DNA, right? Sure, we had a lot of breakthroughs, but again, it's the trust that comes with that. So within the Latino community, there is a trust issue, and when it comes to HIV and AIDS and STDs and viral hepatitis, same thing. We are afraid to know the truth. We are afraid to know our status because what if, right? There's a lot of stigma, particularly working with HIV community, with HIV groups, because of how did you get it? El que dirán? What would they say? So I love the fact that this program is not all about that. It's about, yes, we welcome you no matter what's going on. We want to hear from you. We want you to tell us everything that's going on in your life, everything that's going on with your health, because this is going to help you. It's going to help your family. It's going to help your community, right? And we want more of that.
I think one of the things that I've noticed too when I go to the Latino clinic sometimes, it's just, again, image. What are others going to think of me if I walk in here? The doctor, that privacy thing. I don't want a chisme to start going on. I saw so-and-so seeing a doctor or whatever. So sometimes setting it up in a way where there's more privacy for the participants, so they can feel that confidence that everything is going to be kept confidential from beginning to end. And I've worked a lot with the undocumented because they get the short end of the stick. And we've learned that when we're rewriting or translating things, we have to be careful the words that we use also. For example, we don't use the word investigation because right away that triggers off immigration issues or trouble or illegal. So we just say, for example, in our group, we just say programa científico, so that way they look at it from a different way. So sometimes the terms we use, the expressions we use, we have to be very careful because it'll affect each group differently. So it's almost like you have to learn every Latino culture language because different dialects, different words. I've made the mistake where I have spoken to a Mexican group with my Puerto Rican words and gotten into trouble when I was being innocent because they misinterpreted what I said. So one of the things I've learned is, first of all, find out who am I talking to, where are they from? So in my mind, I know which switch to turn on and which one to turn off, what to say and not to say. And also to be careful with the terminology. Like I said, the undocumented, if you use the wrong words, you can scare them away. And in the Latino community, the word travels very fast. That if you make one mistake, everybody will know about it. And next thing you know, from the line that was there waiting to talk to you, now there's nobody there. What happened? Because it's something you might have said. So, our community is very well in communicating with each other. They can spread information across the board very quickly. So, we have to be careful how we term things and how we say it when we approach them. So that way, again, they can feel that confidence, that privacy, that security, that everything's going to be fine.
I was going to say with what Yuri said earlier, one of the reasons why he thought, Latinos didn't participate in research was because of the lack of trust. I wanted to say I agree with that 100%, but I think there are so many more reasons besides that. I think there's lack of information. I think there's lack of education or access. It is the lack of trust, language barriers, like Edwin was mentioning, cultural fears, not wanting to be a guinea pig, going back to what Michelle said about Tuskegee or Henrietta Lacks, those types of things. So all of that combined, I think kind of just makes one big reason why people don't participate. And we have to do exactly what Edwin and Yuri was saying is, like kind of create that connection. Like he was saying, like, I look like you, I speak like you, you can relate to me, have that connection, but also be as transparent as you can be, which I was mentioning earlier. And then be as informative as you can be. Let the community know we are going to keep your information on a double encrypted server with limited access. You will become a barcode. Here's everything, because that's how I am. And again, I don't know if it's a cultural thing, but I have to know every detail, every little thing before I'm going to sign anything. So be as transparent and informative as you can be. And I also think I had one more point and I just lost it. All right, go ahead, Michelle.
No, I agree. Can you hear me? It's
Yeah.
showing up. Okay. So I got a pop-up window. No, I totally agree with everything that was said. I apologize. I also got dropped out for a second. But I also think, as we learn more of the importance of genetics in our health and what we might be also, prone to, I think that also is a great tool for us to educate our community on. And I think, the barriers that were just summarized, I think are critical, but really turning it around and talking about the importance for us that we participate in the research and the information that comes out of this research. We know that, things work differently in different people. We know that our community isn't the same as other sectors of the population, but even within ourselves, we're not homogenous as Latinos. And so really making sure that new interventions work for us as well, I think is a critical talking point also when we're engaging with the community.
I think also in my experience, there's logistical stuff too, right? So transportation, sometimes research takes time, and participating in research takes time. And so having to access time off if you're going to do that, or childcare, all of those things also come into play, and things that we need to consider. So Edwin, with more than 40 years of experience in community organizing, most of which have been serving the Latino communities, what can researchers and community organizations do to help overcome some of the barriers we've mentioned today?
I think one of the key ones is, and it's been mentioned a couple times, bringing on board people that look like the community. That's going to be the number one thing, because once you bring someone in that looks like you, again, that wall goes down, you feel a little bit more confident. Number two, don't start off by asking questions, because that'll scare them right away. Why do you want to know all this all of a sudden? Build a relationship. That's one thing. We're very family oriented. So building a relationship, to the point of where you feel, let's go have un cafecito together or something like that, because at that point, it kind of like, they open the doors, because once you get them talking, you can't stop them. They'll start sharing anything you want, which is good, is what our goal is. And sometimes the Latino community is going to take a little bit longer than the average person to get them to open up and to share. Again, I go out there and people come up to me to talk to me. And if they're Latinos and they feel comfortable, they'll ask you questions. They'll think you're a doctor because you work for an institution. My thing says here, it says Medical College of Wisconsin, Freighter. And right away they think I'm a doctor, and they start calling me doctor, and I'm going, no, I'm not a doctor, and I explain to them that I'm not, that I'm just part of a research program. And then they kind of like take a step back when they hear the word research. But then you build that relationship. That's so important, to build that relationship, because that's what's going to get them to come back and bring others. Because once you get one of them, believe it or not, the whole family comes along. Everybody starts coming in because they're interested. They start telling you, hey, aquí está mi niño, here's my kid. Can he be part of it too? Well, you got to be a certain age, but give him time. He'll be a bit available, and it's that family feeling. If you can create that family environment in the community, you can pretty much get anybody to join pretty much. We've had, like I said, one time we went out there, we spent 3 or 4 days in one neighborhood and couldn't get it even anything. And then we decided to bring some music along at our table and some free knickknacks or food and whatever. And man, you couldn't get the people away from the table. And they're all talking about, oh, I remember when my mama used to make these and this and that. It would taste like this. What do you put in the recipe? It's not health, but it's a conversation to build that unity. And then before you know it, after that, it all comes in. So having patience with the Latino community, you have to be patient. You have to earn that trust and have people that look like them, so that way they feel comfortable approaching you. I think those are some of the key ones that I've learned from it.
I wanted to jump on what Edwin was saying about having people that look like you, because I think that's super important too, because they can relate. But I also want to stress the importance of having a totally diverse team. When we're on the road, I'm half Puerto Rican, half Cuban. One parent was born in Puerto Rico, one in Cuba, and they didn't teach me Spanish. I didn't learn Spanish. I feel like a huge disgrace. I'm like, Mom, are you serious? And she's like, I had 9 kids. What do you want? Or, and then one spoke English, the other one spoke Spanish. But I think there's an importance to be stressed on having a diverse team, because I've had people walk up and be like, wow, you've got everybody here, you're representing everybody. And that in itself made people comfortable. I don't speak Spanish, but I can relate, even though I don't speak Spanish. But we always have bilingual people on staff. So to Edwin's point, that will make them feel comfortable as well. And they can always talk to that person, if they need to. But I do agree with, at the end of the day, it's about that connection, because I think having those connections and those quality conversations, and the more transparent we are, the more interactions we have like that, the more participation we're going to have. You know what I mean? I think that was it.
I think, Angie, to add on to your point, not only so much that diversity, but also age.
Mm-hmm.
You have to have youth in there too, represented there too. I mean, I come along with the gray hair and they see an older guy there. I'm the father figure or the grandfather figure, depends who looks at me, and you have that. But then if you bring some young people, and that motivates the other youth also, wow, I want to get involved in that too, because I can see myself there. So we're not only doing health research, but we're motivating the community for future medical personnel or future health professionals by just bringing along these role models that they can relate to. Sometimes I'll take along a couple of the medical students with me, the Latino ones, and you'd be surprised when they have their white lab coat on and people come to them and goes like, you're so young to be a doctor. But and it goes from there. It just opens doors and opens the eyes of the possibilities for our young generation also to move forward.
Yeah, having community organizations involved is big too. So not just us, but that's another way to build trust, right? The community organizations around town that they already trust.
Right, right.
They're a part of it.
It's a team effort.
Yeah.
Exactly.
Very much so. I think there's one thing I think we've been talking about without explicitly naming it, is meeting people where they are, whether that's in the conversation continuum, if someone's hesitant, if someone's just learning about research, or someone's very gung-ho and wants to participate, but also about going out into the community, as Angie was just mentioning, working with community organizations, working with people who already have the trust, as Edwin was saying. I think a lot of this is going to the community, meeting them where they are, and also, as you were mentioning, Christina, earlier, like the logistical things, bringing the services to the community, bringing it to when they're available to take advantage of them. We work different shifts. Some people may work the typical Monday through Friday 9 to 5. Others may work the third shift. Others may work weekends. And so being able to have that flexibility in bringing not only the information, but the services to the community, meeting them where they are, is critical.
Great point.
And that is one of the things that all of us does so well. I mean, post-COVID, not so much, but prior to COVID, that's what we did. We were a one-stop shop. Like, we toured the nation, going to these communities, going to community centers, to libraries, to different schools or events or YMCAs. And we brought a mobile clinic, we brought our educational exhibit, and, you know, I could just sit down and by the end of the day, I have a little old lady wanting my Instagram, you know, like, we've had great conversations, and, you know, she wants to keep in touch, and she's learned so much, and she'll come back the next day, even though she already enrolled the first day, you know?
Yeah, I do want to point out something that has been mentioned before. So one thing is the rapport, building rapport with the community, right? It's very, very important. Rapport, in my eyes, equals trust. If you have a great conversation with someone, you know, first impression is everything. So if you start relating to people, to the potential participants of the community, and say, hey, you know, join us in this tent. We have music, we have food, we have stuff. So to me, food is the great universal equalizer. That's me. That's my thing. So to tie that up with community, again, meeting people where they are, and I think one of the things that's very important is tapping into those gatekeepers, this community gatekeepers. If you contact, you know, let's say the main bodega in the barrio, right, and you have a good relationship with them, everybody that frequents that place is going to be like, oh, I wonder what's going on there. Or, you know, if Don Julio, you know, or Don Edwin knows about this stuff, I'm all in, because if he trusts them, I trust them as well, right? So those influencers that we call them nowadays, the millennials, we call them influencers. Yeah. Influencers are very, very important, especially again in the Latino community. If a community sees that this particular person who is well respected and viewed as someone that's a professional, right? If we approach them, they're gonna approach us. The other thing I wanted to mention when it comes to the youth and, you know, technology and all that stuff, everybody wants to do Instagram, everybody wants to be in Facebook, everybody wants to do all this stuff, right? So I like the fact that the All of Us Research Program has a presence in all of these platforms. The social media platform is very important, right? And the last thing I'm going to say is tapping into the news media, right? For us Latinos, Univision and Telemundo are like sent from God. So if they see commercials about this stuff in those networks, they're going to say, well, these are trusted networks, and we're going to go ahead and find out more about that. So I think we need to build a little bit more about that. You know, when we talk about this program.
So I promised I wouldn't do this to you guys, but you brought up excellent points. And we have a few minutes left in this session of our webinar. You've talked about meeting people where they are, having the aesthetics of, you know, being present and having people that look like the community that you're recruiting from. How do we do that post-COVID? I think that's something that our organization struggles with as well. And you know, we do webinars and we have amazing participation rates and exciting panelists that we can bring, and we can bring people from across the nation, but that doesn't always work for our communities because of digital divide, because of just difficulties accessing technology. You know, we serve older adults, and so how can researchers engage folks and build trust digitally? I know we've talked a little bit about social media, but you're missing that face-to-face piece. And so I promised I wouldn't throw an unscripted question at you, but do you have any insights on that?
Yeah, I'll start with that, just because I brought up social media. I feel like I need to address it. Nowadays, I think social media is sort of like, you know, the aunt that is invited to all the parties, right? They were always there, but now because we are so enclosed, you know, in our homes or in our buildings, in our neighborhoods, we need to invite that one person to just shake things up. So I think social media has become a norm for us, more so than before, and you know, inviting trusted community members. Again, going back to the influencers, if you put a webinar or a fireside chat or something like that with someone who is an influencer, I think you will have a lot of traffic in your website or in your webinar. Also, doing things social distance. I think it's building up a little bit more. I know at the beginning of the pandemic, everybody was like at home, closed down. But I think now that with the vaccines rolling out, I think people are little by little, really baby steps, are trying to say, okay, there is a light at the end of the tunnel, right? We can see us going back to a new norm, not normal, but a new norm. And I think that if we do these baby steps and start, doing these things like town hall meetings, social distance town hall meetings and things like that, I think people are gonna start to be more interested in it rather than, oh, I gotta sit through another webinar, right? And using social media also to amplify the message. It could be a pre-recorded thing and then just blast it on your YouTube channel or your Facebook platform things. So I think we need to be more creative about using technology. TikTok maybe, I don't know. I mean, TikTok is a big thing nowadays, so why not?
Especially for
maybe
the
we can have, for the youth. Maybe we can have, Josh Denny, who's the CEO of the program, do a TikTok.
I think
Don't tell him I said that. Don't tell him I said that.
looking at from the older generation, it's going to be hard. Technology is going to be hard. But I think one of the things that attract people, and I'm just trying to think of myself, what would attract me to go listen? If you bring in, this is where we have to spend a little bit extra money and bring in the actors, actresses, musicians, these famous people that everybody wants to hear, and have them sponsor or just be there and just support. I think that will get people to come online and be part of it. Bring in someone like, I don't know, think of a name, somebody can think of somebody that can come in and just says, hey, I support all of us, for example, in health research, and I'm going to share with you why on this day at this time. They're going to show up just for the idea of being able to see this person, be able to talk to them, even if it's just through chat. But that is one tool but then again, we're talking about money. But right now, I think the best thing we can do is through word of mouth, family members. Everybody could still use the phone. I know one thing we're doing here a lot is doing a lot of phone calling, and it's helping to get people, keep that interest in the program going into research. Research is not easy. We all know that. We're all part of it. It's not easy, but it's not impossible. It's a matter of sitting down and we have to kind of like recreate everything all over. It's like going back to step one. Okay, here we go. Let's start over again. Let's do the same thing, but how do we change the format? And not everybody has computers, to be honest, or internet access. So that holds us down. So social media is the way to go nowadays. But again, our hands are tied to part of that.
Yeah.
But
I would mention that, social media, but I think for most people, social media is critical. I would include WhatsApp in that piece as well. We share, because we not only stay in touch with family from afar using WhatsApp, but we also share a lot of what we see in social media through WhatsApp. I get videos and other beyond just plain text and phone calls through WhatsApp all the time. And using that to our advantage. I think our community has smartphones. We've had a lot of Facebook Live events and Zoom type of meetings or any other plethora of platforms. I think we're slowly getting our community more and more adept to these technologies, but it also allows for that in-person substitute that right now we're not able to have. And so it's still a two-way conversation. I think, videos, pre-recorded videos work really well to disseminate messages, but not to have conversations. And so a mix of both of those and using what our community does traditionally use. We know older community members use Facebook a lot, use WhatsApp to stay in touch. Even my 100-year-old grandmother knows how to answer the WhatsApp calls when we call her. And so, you know, being able to share information that way, I think is critical.
Fantastic. We have overrun into our question and answer session, and there are some really good questions that I want to get to. So sorry, Angie. But one of our participants says, as a Hispanic clinician scientist, I think this is very valuable. I would like the opinion of the panel regarding how members feel about being labeled as Latinx as a term. Are all of you comfortable with this? And I think that is an issue in our community is, you know, how are we referring to groups and is that acceptable? So do you guys have any insights on that?
All of a sudden, silence.
I'll be honest. There is a Spanish newspaper in Milwaukee that refuses to use Latinx. They say either I'm Latino or I'm Latina, but I'm not an X. You know, so some people get offended by that. Personally, I tell everybody I'm Latino. That's it. You know, I understand the use of the X, but I think some people get offended by that.
Yeah, I do. I don't particularly use that term at all. I think that it's more of a generational style, right? The older folks gonna say like Latino X, like what is that, right? Again, I understand the use of it. I use Latino all the time as well. Call me old-fashioned, call me an old soul, but to me, Latino, you know, Spanish has, you know, is gender specific. So if you're a woman, you're Latina. If you're a group, you're Latinos, right? So I think that it's more of a generational use. So for the clinician who asked that question, I would say use proper terms, right? If you start talking to someone younger, you know, and maybe want to be hip or want to try to, you know, build rapport with this person, then, you know, you can see how, you know, do a back and forth and see how and what the best thing is to use. But I think, again, from a social work perspective, you know, it's always asking, how do you want to be addressed? Because for some people, especially, you know, in the LGBT community, which I am part of, you encounter this issue with transgender individuals. You know, you can't just say, you know, her or him if the name is a male or female name in the driver's license or in the ID. You need to ask them, how do you want to be addressed? Do you want to be addressed as a he or as a her? You know, tell me what's your name, what's your preferred name, not your given birth name, right? So it's always a matter of meeting people where they are, going back to that, you know, that phrase, and just asking them, you know, you want to be addressed as Latinx. You know, I think the younger population don't really care, don't really mind, and I think it's kind of hip. But for the older folks, I think it's something that it's sort of an offense. Maybe not.
Yeah, I totally agree with Yuri. You know, I use it when whoever I'm speaking to prefers to use it. I defer from who I'm speaking to, but I do think again it is generational. Younger generations prefer it, older generations do not. But I personally I use them interchangeably, mostly depending on who I'm speaking to.
I will say one thing that I think is kind of funny about this is I had said Latinx to my mom and she's like, what? Why do they keep changing things? She's like, why can't we just say one thing? And I'm like, okay, maybe I won't say that anymore.
Yeah, I think we, as an organization, kind of take Michelle's approach. We use a lot of different terms interchangeably. Hispanic doesn't always encompass, you know, our friends from Brazil, and so we'll use Latino to help encompass that. But it is difficult. You have to kind of make sure that I think the best practice is to ask folks how they want to be categorized, if they want to be categorized, that kind of thing. But you know, I want to be respectful of everyone's time, and I know we are coming to a close. So if we didn't answer your questions, we will put those in the comment section when we post our video on YouTube. And for more information on research, please visit our blogs at www.nhcoa.org. And for more information on the All of Us research program, visit www.joinallofus.org. Again, thank you to our panelists, my colleague Christine Perez, who is doing all of our background work and making sure that this webinar was possible, and to all of you for joining us, our attendees, thank you. We invite you to follow us on our social media platforms. You can find us at NHCOA or NHCOA on Facebook, Twitter, and Instagram, and visit our blogs for the latest information about participating in research and for our upcoming webinars. Thank you so much, everyone. Have a wonderful day.
Thank you.
Thank you.